Hi, my name is Lianne Kupens. I'm the WHO representative and the head of country office in Uzbekistan. In Uzbekistan, we have a lot of people who are not aware of what the impact is of smoking. And it is not only the the health impact, the impact on the diseases and the health. It also, if somebody dies, a family member dies, then obviously he's not there anymore. It might have an impact on the family's income. A person, most likely a person who is working in the working force, will disappear, and so there's no income. If you have a lot of people who are dying, which is unfortunately also the case in Uzbekistan, then it has also an economic impact. So the economic growth of Uzbekistan is hindered by the fact that so many people are smoking and dying premature. There's no need for that. A lot of measures has been put in place in Uzbekistan already. The commitment from the government is strong. They have also signed off on the Framework Convention on Tobacco Control, which is signed by almost all the countries in the world. And there are a few things, well, there are lots of things we can do better in Uzbekistan, globally, but definitely in Uzbekistan, where we have anyway the great momentum, the great commitment from the government, from the president. But what we need to do better is to continue the surveillance, the monitoring of the tobacco epidemic in Uzbekistan. Who is smoking? We know in Uzbekistan the men are much more smoking than the women. But we need to prevent that people start smoking. We need to ensure and help the people to stop smoking. So better monitoring, surveillance is needed. We need to also ensure that the smoke-free laws, which are already signed off, which are in place in Uzbekistan, are reinforced. They are there, but they can be revived, let's say. They can get a boost, something that it becomes stronger. For example, we have the smoke-free laws only for the public transport. But why not for the restaurants? Why not for the schools? Why not for offices? Why not for public places where people are gathered together, and when it's a closed space, there's this enormous risk of the second-hand smoking. We also need to do much more about the awareness of the impact on the health and the impact on the family, the economic growth. So the mass media campaigns are important. We need to inform the people, we need to make them aware. We need to try to avoid the youth, the children, to start smoking. It's better to avoid them to start than trying to influence adults to stop smoking. We need to make sure that we ban advertisements, the marketing of the smoking. There's a lot of, promotion of smoking in the world, and we need to ban that. All the advertisement we need to ban. We can also do much better by selling the cigarettes, the packages, putting pictures on it. Bad lungs, awful lungs which are affected by intensive smoking. So that will scare off the people. Another area which is interesting also and very good for the budget, for the income of a country, is the increase of the taxation on cigarettes. At the moment, there is a taxation on cigarettes in Uzbekistan, but you can increase it much, much more. And it will bring in a lot of money, which could eventually again be used for the health sector. It also, most of the time, in most countries, as we have seen from evidence, it will stop or reduce people starting to smoke, or it will reduce people who are smoking, to reduce the number of people who are smoking, because it becomes too expensive. In my country, for example, the Netherlands, as packaged cigarettes, it costs around $10, which is a high price. But it helped to reduce the people from smoking.